Family history is an advance warning system. Diabetes is a family concern. Diabetes in the family tells everyone to be alert, to take care for themselves, their children, and their grandchildren. Type 1 and type 2 diabetes are different. Type 1 diabetes is uncommon. It signals that the immune system is not working properly. Mother or father with type 1 diabetes means their children will have about 10 times the normal risk. That is, they'll have about a 10% chance of type 1 diabetes. Both mother and father with type 1 diabetes doubles risk to 20 times normal and 20% chance. Type 2 diabetes is much more common. Mother or father with type 2 diabetes means their children have twice the normal risk. About 50% chance if they're overweight, 80% chance if they're obese. Both mother and father with type 2 diabetes makes risk almost certain, unless body weight and abdominal obesity are kept normal. Knowing there's a family history is a real advantage. It's advance warning. Type 2 diabetes is not inherited. What's inherited is a low threshold for insulin resistance. Energy management is simply overwhelmed by overeating. Skeletal muscle and liver are using and storing all they can handle. Their cells reject further inward transport of excess sugar and fat. So what is overeating? It's consuming food containing more energy than required for resting metabolic rate and active physical work, and excess even more than can be stored in muscle, liver, or fat tissue. Family history of type 2 diabetes proves a potentially low threshold for insulin resistance to overeating. Usually, insulin resistance increases along with overweight and obesity. But some people who eat more than they need don't trigger insulin resistance. They just become overweight and obese. They eventually have heart disease, stroke, cancer, or dementia, but they don't get diabetes. Avoid overweight and abdominal obesity to avoid abnormal threshold for insulin resistance. Not enough skeletal muscle to store energy is just as bad as too much body fat. Loss of skeletal muscle can cause insulin resistance when there's been a long time with little physical activity. Most of a low threshold is set by parents overeating before their children are born. After birth, the response to overeating continues to form during childhood, adolescence, and adult maturity. The future for your family's history can be changed. If you have children already, help them avoid diabetes before they have children. If they already have children, help them teach your grandchildren to avoid diabetes before they have children. If you have a family history of type 2 diabetes, you have twice the likelihood of developing type 2 diabetes yourself. If you don't have a family history, but you have diabetes, then you are the one who starts the history for children and grandchildren. If you have a family history of type 2 diabetes, avoid overweight and abdominal obesity and maintain a routine of regular exercise. You'll escape having diabetes yourself. What if you don't have a family history of type 2 diabetes, but you have diabetes yourself? Then you have the opportunity to change your family's history. Corrections you make to reverse your diabetes will save good health for your children and grandchildren. If you have a family history of type 2 diabetes, how do you and your family avoid diabetes? By controlling fat stored inside the abdomen and maintaining physical activity. You can control these physical features. Your maximal waist circumference should be no more than half your standing height, about 40 inches for a man and 35 inches for a woman. Your physical activity should include 150 minutes of moderate exercise every week with at least 2 sessions of resistance strength training. If your task is to reverse type 2 diabetes, your maximum waist circumference should be less than 35 inches for a man or a woman. Physical activity every week should include 3 sessions of strength training for 30 minutes. Paying attention to measurements in your children is most important. Their threshold for insulin resistance will determine their health, and it's their health that determines the future family history of type 2 diabetes. How much is too much body fat, and what is too little physical fitness? Size, shape, development keep changing as children get older. Fortunately, the critical features of physical growth and physical fitness can be combined in one metric. Maximum waist circumference for boys and girls at all ages should be less than half their body height. The personal bonds within a family bring extraordinary opportunities to create a good future family history. The power of bonding strengthens trust and spreads enjoyment of personal achievement. Communication across distance and contact in family events together are great opportunities. Sharing makes it possible for all to take pride in success and pleasure from reversing diabetes. And family provides support and motivation for persistence when progress seems difficult. Family Day for Diabetes must be every day. World health is important. It starts at home with each of us. We share experience, support each other, and enjoy good health together as family.